Did you know that a cerebrovascular accident, also known as a CVA, is one of the leading causes of death and disability worldwide? What makes a stroke so dangerous are not only the common signs we know about, but also those that are less known and often ignored. Today, we're going to reveal 7 unusual signs of a stroke that can save lives if recognized in time. Before we move to our list, let's understand what a stroke is. A stroke happens when blood flow to a part of the brain is interrupted, either by a blockage known as an ischemic stroke or by a leak or rupture of a blood vessel known as a hemorrhagic stroke. This can cause brain damage, loss of function, and in severe cases can be fatal. Stroke is a leading cause of death and long-term disability in the United States. The stroke death rate increased from 38.8 per 100,000 occurrences in 2012 to 41.1 per 100,000 in 2021. Additionally, stroke does not discriminate by age. Anyone who thinks that only elderly people are at risk of being affected by a stroke is mistaken. Data from the CDC in 2014 showed that 38% of people hospitalized for stroke were under the age of 65. It is vital to recognize the warning signs and symptoms of a stroke, as quick emergency treatment can mean the difference between recovery and long-term disability. It's really important to be aware of symptoms. For instance, in one survey, while 93% of participants knew that sudden numbness on one side of the body could indicate a stroke, only 38% were familiar with all the major symptoms and understood the importance of calling 911 during a stroke. Do you know the signs of a stroke? Stay with us until the end of this video. Subscribe to our channel and gain access to the best health content on YouTube. Without further delay, let's get to the list. 1. Vision loss or double vision. While many people are aware that sudden weakness on one side of the body is a classic sign of a stroke, it is equally important to recognize that loss of vision in one or both eyes can also serve as a critical warning sign. This visual symptom can occur so subtly that it is often overlooked or mistaken for less serious conditions, which can delay timely medical intervention. Vision loss associated with a stroke can happen suddenly and without any prior warning, making it a serious medical emergency. When blood flow to the areas of the brain responsible for processing visual information is interrupted or significantly reduced, the affected brain tissue is deprived of essential oxygen and nutrients. This disruption in blood flow can lead to a range of visual impairments, and recognizing these changes is crucial for prompt diagnosis and treatment. Individuals experiencing stroke-related vision loss may encounter total or partial blindness in one eye or both. This sudden visual impairment can be disorienting and frightening, as it may happen in a matter of moments. Moreover, some individuals may experience double vision, known medically as diplopia. This condition can create confusion, as a person perceives 2 distinct images of a single object, leading to difficulties in focusing and navigating their surroundings. These vision symptoms can often accompany other signs of a stroke, such as weakness on one side of the body, difficulty speaking, or trouble with coordination. For instance, a person may suddenly find it challenging to maintain their balance or control their movements while simultaneously experiencing vision problems. The combination of these symptoms should act as a powerful indicator of a potential stroke, urging those affected to seek immediate medical attention. Understanding these visual signs is vital because the brain's ability to recover from a stroke often depends on how quickly medical help is received. Early recognition and treatment can significantly impact the outcomes for individuals experiencing a stroke, potentially reducing the severity of brain damage and improving the chances of a more favorable recovery. In conclusion, while sudden weakness is a well-known sign of a stroke, loss of vision, whether in one eye or both, should never be dismissed. It is essential to remain vigilant about any abrupt changes in vision and to act swiftly in seeking medical assistance. By doing so, individuals can help ensure they receive the care they need to mitigate the long-term effects of a stroke and safeguard their overall health.
2.
Vertigo and loss of balance. Vertigo, along with loss of balance and coordination, represents a lesser-known yet significant set of symptoms that can indicate the onset of a stroke. These symptoms can arise suddenly and without warning, making them particularly alarming for individuals experiencing them. Vertigo is characterized by a sensation of dizziness in which a person feels as if the environment around them is spinning or moving, even when they are standing still. This disorienting experience can lead to feelings of nausea and confusion, making it challenging to carry out everyday activities. The sensation of vertigo can be especially concerning when there is no obvious trigger or cause, such as inner ear issues or sudden changes in position. In many cases, individuals experiencing vertigo may also encounter difficulty maintaining their balance, which can result in stumbling, an inability to walk steadily, or even falling. This loss of balance may indicate that the stroke is affecting specific areas of the brain responsible for motor function and spatial awareness, ultimately impairing the individual's ability to navigate their surroundings safely. It's important to note that these symptoms can be easily mistaken for other medical conditions, such as labyrinthitis, which is an inner ear infection that can also lead to vertigo and balance issues. However, when vertigo and loss of balance occur in conjunction with other classic stroke symptoms, such as sudden weakness, confusion, or speech difficulties, they become critical warning signs of a potential medical emergency. In such situations, immediate medical attention is essential to ensure a timely diagnosis and appropriate intervention. Recognizing the potential link between vertigo, loss of balance, and stroke is crucial. Many people may overlook these symptoms, attributing them to fatigue or minor health issues, but the reality is that swift action can significantly affect outcomes. If you or someone around you experiences vertigo along with other concerning symptoms, it is vital to seek emergency medical assistance right away. In summary, while vertigo and loss of balance or coordination may not be the most recognized signs of a stroke, their sudden onset can indicate serious underlying issues that warrant immediate evaluation. Understanding the connection between these symptoms and stroke can empower individuals to act quickly, ultimately improving the chances of a favorable outcome and minimizing the risk of long-term complications. 3. Sudden confusion. Sudden confusion, characterized by unexpected difficulty understanding what is happening around you or expressing yourself clearly, is an important sign of a possible stroke. This symptom can manifest itself as disorientation, problems following conversations, difficulty formulating words, or understanding other people's speech. Stroke affects the brain in ways that can temporarily or permanently disrupt cognitive abilities and communication, depending on the area of the brain affected and the severity of the damage. When blood flow to areas of the brain responsible for language and cognitive processing is disrupted, individuals can experience aphasia, a condition that affects the ability to communicate. Aphasia can vary in severity, from difficulty finding the right words to a complete inability to speak or understand spoken language. This stroke symptom is particularly alarming because it can appear suddenly and without warning, often without being accompanied by pain or any sensation that indicates a serious health problem.
4.
Severe headache with no identified cause. A sudden severe headache with no known cause can be a critical and alarming symptom, potentially indicative of a stroke, particularly in cases of hemorrhagic stroke. Hemorrhagic strokes occur when there is bleeding within the brain, which can lead to devastating consequences if not addressed promptly. This type of headache is often described as the worst of the person's life, distinguishing it from typical headaches, which may be more gradual in onset or related to common triggers such as stress, dehydration, or dietary factors. In patients experiencing a hemorrhagic stroke, the headache may come on suddenly and may be so intense that it feels unbearable. This acute headache is often accompanied by a range of other symptoms, including nausea and vomiting. These gastrointestinal symptoms can result from increased intracranial pressure caused by the bleeding in the brain, leading to irritation of the brain tissue and the areas responsible for regulating nausea. Individuals may also experience sensitivity to light, a condition known as photophobia, which can exacerbate their discomfort and make it challenging to engage in everyday activities. Additionally, changes in consciousness can occur, ranging from mild confusion to complete disorientation or loss of consciousness. Unlike common headaches such as migraines or tension headaches, which typically have identifiable triggers and a more gradual progression, the headache associated with a stroke manifests abruptly and often intensifies rapidly. The mechanism behind this severe headache and hemorrhagic stroke involves increased pressure inside the skull due to the accumulation of blood from the ruptured blood vessels. This increased pressure can irritate the meninges, the protective membranes that line the brain, or other brain tissues, resulting in intense pain. In some instances, this pressure may lead to significant complications, including brain herniation, which can be life-threatening. Recognizing the nature of this headache is crucial. A sudden onset of an extremely intense headache, particularly one that feels different from any previous headaches experienced, should not be ignored. It is vital to understand that this symptom requires immediate medical evaluation. Early intervention can be critical in determining the patient's prognosis and improving long-term outcomes. Prompt treatment may include interventions to relieve the pressure, repair damaged blood vessels, and minimize brain injury. It is also important for individuals to be aware of their body and any changes in their usual headache patterns. If a headache is accompanied by additional symptoms such as weakness, numbness, difficulty speaking, or changes in vision, these could further indicate a stroke and necessitate urgent medical attention. In summary, a sudden severe headache with no known cause should be treated as a medical emergency, especially when it may suggest the occurrence of a hemorrhagic stroke. Understanding the signs and symptoms associated with such a headache can empower individuals and their loved ones to seek timely medical help, ultimately improving the chances of recovery and minimizing the risk of serious complications. 5. Sudden nausea or vomiting. Nausea or vomiting that comes on suddenly can be an unusual but significant sign of a stroke, especially when there is no other obvious explanation, such as a viral illness or food poisoning. This symptom can be particularly common in cases of hemorrhagic stroke, where bleeding in the brain can increase intracranial pressure, causing discomfort and vomiting. The cause of this symptom is the direct effect of pressure or damage to areas of the brain that regulate vomiting and nausea. 6. Sensitivity to light. Increased sensitivity to light, known medically as photophobia, is not typically recognized as a common symptom of a stroke. However, it can occur in certain cases, often serving as a critical indicator of an underlying neurological issue. This symptom may arise due to several factors, including increased intracranial pressure or bleeding in areas of the brain that are adjacent to the nerves responsible for visual perception. Photophobia can manifest in various ways, ranging from mild discomfort to an intense aversion to light. In some instances, even normal indoor lighting or sunlight can appear excessively bright, resulting in significant discomfort for the affected individual. This heightened sensitivity can be particularly troubling, leading some to avoid brightly lit environments altogether. As a result, individuals may find themselves seeking refuge in darker spaces, which can affect their daily activities and overall quality of life. While photophobia can stem from various causes, such as migraines, eye strain, or other medical conditions, its presence in conjunction with other neurological symptoms should raise immediate concern. When accompanied by more classic signs of a stroke, such as sudden weakness, speech difficulties, or visual disturbances, photophobia can signal a potentially serious condition that requires urgent medical evaluation. Recognizing the significance of photophobia is crucial, especially since many individuals may overlook or dismiss this symptom as a mere annoyance. The interplay between light sensitivity and other stroke symptoms may indicate increased pressure in the brain, which can disrupt normal neurological function. Early detection and intervention can be pivotal in improving outcomes for individuals experiencing a stroke, as timely medical treatment may help mitigate brain damage and enhance the chances of recovery. In summary, while increased sensitivity to light is not commonly associated with strokes, it can serve as an important warning sign when it appears alongside other neurological symptoms. Being aware of this potential symptom and its implications is essential for anyone seeking to understand the complexities of stroke recognition. If you or someone you know experiences photophobia along with other concerning signs, it is vital to seek immediate medical assistance to ensure the best possible outcome. 7. Change in speech pattern. Changes in speech, including slurred speech, difficulty choosing words, or speaking incoherently, are the most recognized signs of stroke, but their presentation can vary significantly. These changes may indicate a stroke that is affecting areas of the brain responsible for language and communication. Changes in speech patterns can range from mild to severe and can be one of the first signs of a stroke, especially in cases where other causes such as intoxication or hypoglycemia can be excluded. Quickly identifying these changes and seeking immediate medical treatment can improve long-term speech and language recovery. Now that you're familiar with the signs, it's important to understand the risk factors, such as hypertension, diabetes, smoking, obesity, family history, and physical inactivity. Recognizing and managing these factors can greatly reduce your risk of stroke. Prevention starts with lifestyle changes. It is important to change habits, maintain a balanced diet, engage in regular exercise, control blood pressure and cholesterol, and avoid smoking. Smoking is the cause of many diseases, so stay away from cigarettes. Keeping a healthy weight and monitoring any pre-existing conditions are vital steps in prevention. When a stroke happens, it's crucial to act quickly. The treatment varies depending on the stroke type and may include medications to dissolve clots or surgery to fix damaged blood vessels. Rehabilitation plays a vital role in helping the patient lead a full life, aiming to restore function and prevent future strokes. Knowing these unusual signs of a stroke can be the difference between recovery and serious consequences. If you or someone close to you experiences any of these symptoms, seek medical help immediately. Your quick action could save a life. If you found this video helpful, please consider giving it a like and sharing it with your friends and family to help spread potentially life-saving information. Don't forget to subscribe to our channel and click the notification bell for more vital health information. Thank you for watching. Until the next one.